Our next speaker is Dr. Sachin Kamath, who grew up in Sarasota, Florida, where he attended New College, the Honors College of the Florida State University System. Through his extensive experience with skin cancer radiation, Dr. Kamath was instrumental in implementing the groundbreaking ZOFT EBX system at Diablo Valley Oncology Radiation Department. He's one of the most experienced physicians with this procedure in treating squamous and basal cell cancers in the country. And with that, welcome.
Thank you very much. It's great to see such a large turnout for such an important cancer. As Dr. Lee mentioned already, skin cancer is the most commonly diagnosed cancer, and as we move into the future, as we all get older, there will be more cases of it, and we will probably all have some type of skin cancer. Growing up in Florida, I saw a lot of skin cancer, and probably the case that I remember the most as a medical student that made me go into the oncology field and help develop my interest in skin cancer treatment was actually a fellow at the VA. The first day of my internal medicine rotation, walked in, met my patient. Patient had no nose, the eyeball was gone, and I thought, wow, obviously something happened, and I thought maybe it was trauma. Maybe he had an accident, something happened, lost his nose, lost his eye. And as we started talking, I realized this was just from a basal cell skin cancer. And I thought, oh my gosh, that's, I would never have guessed that something like that could happen. So it's very important that we have meetings like this and you all go out and let people know. Basically, we want to educate people about screening and early detection, early diagnosis, because the earlier that we can catch these cancers, the less treatment that's required, the higher our cure rates, the better our outcomes. So with that in mind, we're going to talk a little bit about the role of radiation therapy for non-melanoma skin cancer. So we're going to talk a little bit about how we treat basal cell and squamous cell cancers with radiation. So when we talk about radiation, we're talking about simple x-rays that we've all had when we've had a chest x-ray, a bone x-ray. But the x-rays that we use in radiotherapy are high energy x-rays that can actually kill cancer cells. The treatment itself is non-invasive and it's a painless approach. Like surgery, radiation therapy is a localized therapy. We're just treating the area that's involved where we think the cancer cells could be hiding. We're not interested in treating the whole body. So a lot of people that get radiation therapy for certain types of cancers also will get chemotherapy. And sometimes it's easy to get the side effects from radiation therapy and chemotherapy confused. Radiation therapy doesn't circulate in the body, it doesn't build up in the body. It's a very superficial treatment when we're treating skin cancers. As Dr. Lee already mentioned, surgery is still considered the gold standard for skin cancer treatment. But radiation therapy can offer an excellent alternative option and sometimes needs to be used after surgery as an adjuvant. So when do we use radiation therapy? Sometimes we see skin cancers in cosmetically or functionally sensitive areas on the face, eyelid, cheek, nose, lips, ears, sometimes on the legs. And these areas can be very surgically challenging. We see skin cancers in patients that have medical problems that makes surgery difficult or challenging. For example, patients that have wound healing problems, patients with diabetes or circulation issues, patients on blood thinners can sometimes pose a challenge. Skin cancers, as Dr. Lee mentioned, that have not been completely removed with surgery or that may reoccur after surgery, sometimes we think about using radiation in these situations. In situations when the margins are close or positive, that is, that there's a concern that the dermatologist has, that the Mohs surgeon has, that maybe there's some cancer cells that have been left behind, we would consider radiation in these situations. There's times when these cancers will wrap themselves around blood vessels and nerves. And when we see that, we also recommend a little bit of low-dose radiation to that area to make sure that each and every single cancer cell has been taken care of. There's situations where we see sometimes very aggressive cancers. We saw a picture of the basal cell cancer, for example, and the cancer that I referred to that basically had destroyed the nose and tracked up into the eye. In these situations, again, we would consider some radiation after surgery. Sometimes these cancers can grow deep down into the cartilage of the nose or the ear, or grow down into the bone. Again, a situation when we would use radiation. So there's different types of radiation therapy, and most people have heard about some of these different types. But it's interesting to mention that when you're dealing with skin cancer, you're generally treating with X-rays that don't need to penetrate very deeply inside the body, so we're talking about superficial treatment. And there's generally two ways that we treat skin cancer with radiation. The most common approach that's used out there is using our bigger linear accelerator radiation machines. And you'll see a photograph here of one of these machines, and I'm sure most of you have seen pictures of these machines. When we treat these big machines to treat skin cancer, we're generally treating with what's called electron therapy. And electrons are like X-rays. They're a very superficial treatment. They don't penetrate very deeply. When we use electron therapy, we're generally treating larger areas of skin. So anytime we're dealing with a larger skin cancer, we're generally using these bigger machines. Generally, it does take 4 to 6 weeks of daily radiation, even though the treatment just takes a couple of minutes, and we're able to get people in and out of the center in 10 to 12 minutes. The treatment does require daily treatment. It's usually 25 to 30 plus treatments. But again, these are used for larger skin cancers. Again, our goal is to catch these early when they're small so that we don't need to do this type of treatment. The other type of radiation that we use, and this is a newer form of therapy, for us as oncologists that specialize in skin cancer treatment, to us it's very important to have all of the tools that we need to be able to take care of each and every single skin cancer that we see. And our goal is to make the treatment as easy as we possibly can. This is a new type of treatment. It's called electronic brachytherapy using the Zoft system. With this machine, and you can see the photo doesn't really do it justice, but this is a small portable machine that's about half the size of actually this podium. The amazing thing about this machine is it uses an X-ray, miniaturized X-ray tube that will deliver radiation to very short distances. When we're treating skin cancer, it's great because we're just interested in treating millimeters of tissue. And with this machine, we're able to focus that radiation so well that instead of taking 25, 30, 35 trips to come and see us, we can give the radiation in larger doses and allow us to deliver that treatment in fewer treatments. So with this machine, we actually apply the radiation directly to the skin. Again, it's used for smaller cancers. Generally speaking, we can treat cancers of up to 3 centimeters with this type of radiation. Treatments will generally be given twice a week instead of daily, and it will be over a period of 4 to 5 weeks. Each treatment lasts 2 to 3 minutes, and again, it's completely non-invasive and painless. As Dr. Lee already mentioned, of course, we feel like the gold standard for skin cancers is surgery. In my mind, a very small percentage of skin cancers will ever need radiation. In most of these cases, we'll use radiation after the surgery, once we already have a better idea of what we're dealing with. But there are a few situations when the dermatologist makes that decision and says, you know what, maybe the surgery is not the best thing here and maybe we should use radiation instead. But again, the bottom line is screening, early diagnosis, catch these early so that we can do less treatment and take care of them. Thank you.